that all over again. So. Hi, good morning, everyone. Thank you so much for joining. My name is Kristin Snowden, and I'm a licensed marriage and family therapist in the state of California. And this is a free webinar that we provide through sexandrelationshiphealing.com. So I'm always going to encourage you to go down to the description below and click on the link if you want to join anytime. It's the second Wednesday of every month, 9:30 Pacific time, totally free. Also through sexandrelationshiphealing.com and kristinsnowden.com. Join the mailing list from Kristin Snowden and sexandrelationshiphealing.com. You can find out about all these events that are going on. Lots of workshops, free webinars, resources. They're here for you. And what do we cover? We cover all things relationships because we never go to school to learn how to do relationships. And we learn through muddling through them, trial and error, lots of pain and hurt. So I try to talk about everything that comes up while I am practicing couples work, my work in residential treatment. We have a special focus on addiction recovery, but it's also about communication, setting boundaries, codependency versus prodependency, understanding shame and trauma and how those things play a role in how we show up and how we show up in relationships. So without further ado, let's talk about today's topic, which is two words that often get interchanged with one another. And I think we need to create some clarity, which is an addict a narcissist, or is a narcissist an addict? Because oftentimes, many of you here are betrayed partners. Either you are the addict in recovery, or you are someone who loves someone who's struggling with porn addiction, sex addiction, substance abuse issues. Maybe you've experienced infidelity or other types of betrayal. And one of the big questions that we always ask when we're deciding, should we repair the relationship? How do I heal? How do I move into another relationship if one ends? Is the big questions of, is my partner able to heal? Are they able to change? How deeply embedded are these behaviors in them, right? The denial of the problem, the lack of accountability that they're willing to take, the minimization, the lying, the sneaking around. And the big one is the apparent lack of consideration for other people's feelings, how their behaviors impact other people. The questions that my betrayed partners always have are, how much of these behaviors are part of the addiction? And then how much of them are perhaps something more? And so then they bring in the topic of, I read about narcissism. In fact, a key word that everyone finds my website is narcissism, narcissistic abuse. It's a really hot topic in this day and age. And so there's a strong focus on, what is narcissism? Is my partner a narcissist? And what's the difference between a narcissist and an addict? And above all else, can narcissists heal and recover? And can addicts heal and recover? So while I can't diagnose your partner, obviously, I don't see them, I don't know them. What I can do is provide you with some definitions, help you understand what narcissism can look like, what addiction can look like, and most importantly, help you understand what recovery can look like when either a narcissist or an addict tries to move into, okay, this isn't working for me anymore. It's hurting me, it's hurting others, and I want to move into a healthier way of connecting with myself and others. So I'll kind of fast forward to the end of the story, which is that narcissists absolutely can be addicts, and addicts can certainly have narcissistic tendencies, be a narcissist, so to speak. Most of these behaviors and personality issues stem from trauma and early attachment wounds, and we'll try to talk about that a little bit. So I can understand why they're intertwined. So education is key, because my hope is that you can take all this information, take it into your couples therapy, take it into your individual therapy as you ponder those original questions. Can my partner change? What would recovery look like? Do I have to keep dealing with this for the rest of my life? Or are we going to move on to a healthier way of connection? So let's start with some definitions. Narcissism is a personality disorder. So it's a little bit different than the way they define addiction. Addiction's kind of a focus on behavior, like so how I act and the choices I make around the substance use or the drug of choice, whether it's sex, porn, toxic relationships, online shopping, eating, etc. Whereas narcissism is kind of saying like, hey, this is just like, this is the person's personality. This is kind of what exudes out of them with all their behaviors. So the DSM, the Diagnostic Statistical Manual, generally defines narcissism as an inflated sense of importance, a deep need for excessive attention, admiration. A narcissist tends to struggle with engaging in meaningful or successful relationships. They have a lack of empathy for others. They have a pattern of grandiose beliefs, arrogance, and a very low tolerance for any kind of criticism. So they are not one to accept any kind of influence. They kind of always need to be right, the most knowledgeable, etc. Now, one of always the requirements to get a diagnosis is that there has to be problems surfacing in that person's life, relationships, work. You know, they've lost jobs, maybe they've gone to jail, they've broken laws, they can't hold on to relationships. So everything works until it doesn't work anymore. And there has to be signs that this narcissistic behavior isn't working for the person anymore. Now, let me qualify that. Someone can have narcissistic traits, or as some people say, narcissistic styles, because those can kind of be just defense mechanisms. Let me differentiate that. So if, let's say, I, for the most part, have successful relationships, successful working environments, but then I go into a training where I have a bunch of colleagues who are intimidating to me. You know, the part of me wants to impress them, and you know, my shame is like, oh, who do you think you are? You're not as well educated as they are, or maybe they might think that you're not smart enough. So my defense to that presenting environmental moment will be a narcissistic defense. I come in and I pretend that I'm smarter than everybody. Maybe I put a couple of the people down with, you know, passive aggressive comments. I kind of puff up my chest and pretend to be bigger than and better than, because I don't want them to catch on to the fact that in this particular moment, I'm feeling small and scared and have my shame voices kind of whispering at me that I'm not enough. The difference between narcissistic traits and a narcissistic personality is that the narcissistic defense comes and goes depending on a presenting issue, versus if I have a personality disorder, I am presenting this way all the time. Good days, bad days, shame, no shame, workplace, relationship, it's across the board. So hopefully that qualifies and clarifies the difference between narcissistic traits and true narcissism. Now let's talk about addiction. There's a few things that are according to the DSM's criteria that you have to meet for you to be considered an addict. Most important ones are your use of this substance. Now remember, it's not just drugs, alcohol, so something I consume. It can be me, video gaming addict, porn addict, online shopping. I could be a rageaholic. I could be addicted to really toxic, unhealthy, tormenting relationships. So these are all various ways I can have a substance-induced addiction or substance use addiction, or what they call process addiction, so behavioral addictions. And the use has to kind of create some kind of serious, dangerous issue. So maybe you break laws in order to keep it going. You get a DUI, driving under the influence. You get into fights and rage around other people. You steal credit cards and steal people's money in order to maintain the addiction. Dangerous use, or actually, obviously, the consumption of chemicals. Oh my gosh, overdoses have gone up crazy amounts right now. So dangerous use, right? Chemical use, using a prescription more than you're supposed to. Those are all dangerous, illegal uses. The use of whatever that addictive substance is has to cause social and relational problems. So a similarity with the narcissism. When the addict is not using the substance, there has to exist two things, right? These cravings for it, to wanting to get back on the computer, get back into the sex addiction, go back on the online shopping, and a withdrawal when they're trying to go without it, or when they are unable to go. They have to do a 9-to-5 job, so they're not allowed to sexually act out during that time, but they have withdrawal periods, etc. Or they're under watch and people are watching them and they know they can't get away with it. So there's a withdrawal, anxiety, perseveration. That's kind of what comes up. For those who struggle with addiction, there has to be an increased tolerance. So I need more of it in order to get as high. And I can explain it, it's like from, okay, just a little bit of cocaine or a little bit of alcohol used to do the trick. And now I need more, I need more of the pills to get as high or to get as strong of the effect. But maybe the online shopping or the gambling is, I need to put more out there. I need to spend more, bet more. The porn use can be like vanilla porn used to, work for me, but now I need to start kind of leaning into the more fringe type of pornography, which for triggering reasons, I won't get into that. I have to use more longer. So my original spending or porn use or substance use was, a certain amount, and now I'm using it more often. I'm using it for longer periods of time, etc. Another criteria is repeated attempts to stop or control the problem. Oh, this isn't working. I swear I'm not going to do this anymore. I'm going to give it. Okay, I'm going to start for Lent. I'm going to give it up and I'm not going to do it anymore. I tell clients when they're like, yeah, I'm here because I think I might have a problem. I'm like, well, that alone is a really interesting thing. Why I'm going to not drink for dry January. Well, why? What's going on? Let's learn more about that. Why are you saying I need to stop drinking, or I'm not going to drink on Mondays, or I'm not going to drink hard liquor, something like that? Why are you creating these stories about rules around use? I want to know more. Physical and psychological problems or consequences, right? Are there physical consequences? Are you suffering anxiety, shame, trauma, torment, struggle around the use that you are doing, the lying, the sneaking around, etc.? Have you given up other activities in your life to engage in this, right? Are you leaving work early? Are you not engaging with your family? Are you stopping hobbies? Are you saying no to other things because you are obsessing over this particular addiction? And then I already talked about cravings. So those are some of the requirements in order to decide if this isn't just, okay, I use substances, or I have a problem with online shopping, versus like, no, this is a true addiction. Now, what's interesting is when you think about what narcissism looks like and what addiction looks like, this is why you see them overlap, because this is what it tends to look like when there's both not narcissism, but then me also working with addicts. I see this a lot as well, which is that everything kind of goes through the mind. It's everything's rationalized versus the heart, right? So I skip the like, what am I doing? What are my goals? Who am I as a person? How are my actions impacting other people? And instead I just go through the mind. Me want, me don't want, me like, me don't like, right? It's through the mind, it's through rational thought. I would say for like sex addicts who are married, their stories are often like, oh, well, what she doesn't know is not going to hurt her. I provide her this great home, right? It's not about, wow, I am going out to massage parlors and doing X, Y, and Z, or I'm having multiple affairs, etc. It's I go through the mind and not the heart. And with that also comes a sense of entitlement, right? For not just narcissists, but addicts. I deserve this. I need this. This is the only thing that meets my needs. No one else can meet my needs. This is what I need to do. They kind of view the world as like a lab, rational thought, not emotional. I kind of talked about that. They can often find your stress, your struggle to be contemptible. Like, how dare you? They get highly defensive about when you're not doing well, when you ask me questions, when you're saying what's going on, when they say, what's going on with you? You look sick, you look, you're not paying attention, you're disappearing for, instead of being like, oh, let's talk about this. Let's get curious about this. Tell me more. It's contempt. It's how dare you, blame you, you're the problem, gaslight, etc. There's often high levels of control and micromanagement, right? So it's, you're allowed to do this and that and this, and I'm, you're not allowed to ask me these questions. You have to do this, I have to do that. Focus on being right? This isn't a you and I relationship. This is, I do what I need to do all the time when I need to do it. And you're just kind of a person who's watching it happen. I'd like, let me do my thing. Narcissists and addicts will often play the victim, right? There's this high focus on blaming everyone else, every other situation, rather than taking ownership of how their behaviors impact other people, how they've, that saying I always say, hurt people, how they may have experienced trauma and hurt as a child, but they use that as an excuse versus really wanting to do work, dive in, repair it, and heal it to be better and do better. They can, both narcissists and addicts can engage in love bombing, this concept that it's like, oh, I idealize you, what I need you to be, and then suddenly dismiss you, get really angry at you, withdraw from you when you kind of don't let me do what I want to do. You aren't what I want you to be in that moment. So there can be that, or we get in a fight and then there's love bombing. I swear I won't drink again. I swear this was just a one-time thing. You're the only person for me, idealizing you again. And then the dismissal, the like, you mean nothing to me and I'm going to go get my needs met however I want to get them met. Testing loyalty. So I see this a lot, especially during the recovery when addicts are in that vulnerable state. Will you stay? Pushing, kind of prodding, testing. How loyal are you to me? Will you leave me? Oh, I bet you're just going to leave me now. Kind of testing that kind of stuff from that fragile place. And I think I said idealizes you, then struggles when you show that you're human, you're flawed. Not what you need to be to complete their fantasy or idealism. So there's this low tolerance for like your flaws, your needs, the fact that you have good days and you have bad days, and that it's my job as a partner or a loved one to show up for that. This is also major common overlap, is that the consequences of loving or being in a relationship with an addict and a narcissist are very similar in that the loved ones often feel like they're crazy. They've lost their connection with their instincts. They're emotionally exhausted. They're like, what is going on here? The puzzle pieces aren't fitting together. And if you want to learn more about that, watch the video I just posted last month, which is addiction and is infidelity emotionally abusive to the loved ones? Because that really clarifies what you experience when you're in a relationship emotionally with an addict or someone who's kind of sneaking around living a double life. So you can see there's lots of overlaps about what they both look like, but the big issue is, I always say when I worked in residential treatment, where people come in to get recovery for over a decade now, and I will say nearly every person that walks in that's an addict, in their active addiction, they appear to be narcissistic. Everything is everyone else's problem. They minimize it. They seem to not have feelings or empathy for other people or remorse for the most part. But I will say those that get recovery, that work a program, which is what I'm going to talk to you about, those things tend to be replaced instead with the really important life personality changes, which is that there's this new humbleness, there's this kind of breakdown of emotions, of surrendering, admitting that you don't know everything, that you're powerless, that your best thinking got you here. So let's go back for a minute. Ironically, when I was thinking about this, now I don't work, by the way, like 100%. I don't work as much with narcissists as I do with addicts, but I feel like, again, most addicts appear to be narcissists upon day one. So I always wonder if true narcissists ever worked like a 12-step program, what would happen? There's entire schools of thought that believe that narcissism, because of the trauma that they were exposed to in their childhood, the severe fear of just not being enough, or being told that they weren't enough, or being made to feel so inferior that the only coping skill they could make it through life was to just pretend that they were better than everybody, to not accept any kind of influence, to lean into the fantasy of being grandiose and better than, because I can't handle the reality of what if I'm just another flawed, imperfect human being, then what am I? What do I have to offer this world? So some people believe that is irreversible. Obviously, in my job, in my world as a therapist, I have a basic kind of altruistic belief that every human is capable of change. Maybe they need a little extra trauma work, maybe they need a little extra love, acceptance, maybe they need some work with a higher power or a spiritual source, etc. I find that addicts who move quickly from that highly narcissistic, kind of filling all the lists of the symptoms I told you about what addicts look like when they're in their addictive element, have leaned into some kind of recovery community, like a 12-step community. As Scott says in that book that I wrote with him, Life Anonymous, that he originally, he's an addict, when he originally went to recovery, he just did it for consequence avoidance. And so that's not uncommon, ladies and gentlemen, for the addict to still appear narcissistic, look like they're going through the steps, trying to be better. Fine, I'll go to therapy. Fine, I'll go to couples therapy. Fine, I'll go to these 12-step meetings. And for it to initially just to like shut you up, to please you, to avoid going to jail, to avoid, losing their job, to look good socially again, so they can kind of just get back to their addict whenever they want to. Or better yet, I've stopped behavior, right? I've stopped the alcohol. I've stopped having sex with other women or men, like, okay, leave me alone, but then still engage in the narcissistic type behaviors of like, I get my needs met at any consequence. I have no empathy for you. I always blame other people. I don't take accountability. I can't hold space and tolerance for you to have feelings and for you to have needs, right? So we can get rid of the addiction, the substance, but still have those types of behaviors. So that's common for that to start. And I'm hoping Tammy will say more about her experience with that, but they start that way. It's like conflict and adversity and consequence avoidance. But the hope is that when you work things like the 12 steps, it's really meant to chisel away at all those kind of things. I mean, steps 1 through 3 are all about owning, God, not only am I not grandiose and like need attention and need validation, but holy crap, like, not only do I not know everything, I don't know a damn thing. Like, I am powerless and my life is unmanageable. And it is such a hot mess that I have to accept influence from these fellow, fellowship people who have recovery, who have their life back online, and some kind of higher power, some kind of spiritual practice that allows me to humble myself, place myself in this world, get out of my grandiosity, and connect with a therapist, a sponsor, other people who actually do have successful relationships, who do know how to practice empathy and feelings and conscientiousness with other people, and who are more like productive and connected and have purpose in life. When you complete steps 4 through 7, and again, I have all these videos on how anybody can practice the 12 steps. But when you do steps 4 to 7 in the 12 steps, that's all about owning that part where like, yeah, maybe I was victimized at one point. Maybe I did not get the love and connection and validation that I was looking for. I can certainly take that on, but there's a whole other part that, then I used it as fuel to hurt other people. I shut down my emotions and said, oh, these sucked so much. I don't want to have emotions anymore. How about I just am powerful instead of being vulnerable? And how many people I hurt and mowed over. It's steps 4 through 7 are about owning what your not so great parts are. And it sucks and it's painful. And there's lots of shame that comes up and trauma that comes up, but that can all be worked through. And then on the other side of that, you have someone who's far more connected with themselves, what they're capable of when they don't stay on track, and then connected with other people, that wants to have empathy, that wants to connect with other humans. Because remember, we are neurobiologically wired to connect with other people. It is not natural for you to not feel empathy when someone's sitting there crying, saying, please stop abusing substances. Please get help. I love you. Please stop stealing from us. Please stop lying to us. And then to just be kind of an emotionless statue. That's not natural. And 12-step work, trauma work, shame work can often help you get through to the other side, because those usually are defense mechanisms. At some point, I had to stop my emotional development, i.e. figuring out who I am, learning about all these gamuts of emotion, learning kind of the perfectly imperfect, messy way of loving other people. And sometimes that leads to the greatest love and feeling in my life, but then also the greatest disappointment and pain and hurt. They say an addict's emotional age stops, their development stops the day they start using substances, because we learn through discomfort and struggle and trials and tribulations. And when we end that process through just numbing it out, distracting, going into fantasy, living in grandiosity, living in a world where it's all about just meeting my needs, getting everything met, and nothing else matters, that stops our growth and emotional development. So the other parts of the 12 steps, are about, steps 8 through 12 are about working to repair our current relationships, future relationships, humbling ourselves to others, owning what we've done wrong, continue to work with the community, right? So being of service to other people, going to meetings, sharing your story so you can inspire other people, helping others who are struggling so you can get out of your own crap, your own grandiosity, your own need for validation and attention, and move into a place where you want to help others with what you've learned. And just this basic, the opposite of addiction and narcissism is owning that you need other humans, that you cannot do this alone, that you just need to go, owning that you don't just need more drugs, more sex, more money, more success, that is not going to fill your soul, that you need to lean into this community, to loved ones, to be actually vulnerable, the thing you've tried to avoid the most with your addiction, with your narcissistic defenses, and lean into other humans. So let's just close with this. When I am looking at addicts in recovery, or even let's say a couple that's in trouble and the wife or the husband swear that it's because their partner's a narcissist and that's why the coupleship's not going to work, I look for a couple things. I look for willingness, first of all. Are they showing up? I don't work that much with, I guess, full-fledged narcissists because they won't end up in a therapist's office. They won't end up in addiction treatment. So for the most part, I get people who have some level of willingness, even if it's like their wife or husband dragged them in there and they want to just have conflict or consequence avoidance. So I look for willingness. I look for, is there any ownership of their own faults? Is there any insight? about what they've done, why they've done it? Or is it just a big laundry list of how they've been done wrong and all these things that they could or should be blaming? You know, men don't have emotions. Men don't need to do that. This is the woman's job, that man's job, etc. Understanding where their flaws might have come from, right? How to manage these flaws, right? These maybe narcissistic tendencies, or my desire to go get my needs met in this way, my ease in lying and manipulating other people, you know, where that came from, how I learned it, because those are learned behaviors, and what I'm going to do to manage it in the future. And above all else, I look for empathy, this understanding that my choices impact other people. Me lying to other people hurts not just them, but it hurts me, because ultimately I have to sleep with myself at night. And wow, I've been denying myself, realizing how crappy I feel, that I walk around, I try to puff up my chest and pretend to be better and know better and everything, but that just reinforces the story in my head that I suck even more. And I'm stuck in this vicious cycle that I can't get out of. So I look for those kind of things. Warning signs would be, now I can't give you like a date that's like, okay, if they start recovery in January, by December, they should have, you know, empathy and compassion. But those are things that I start looking for, right? Signs that they will lie, but they will start saying, oh, I lied about this. I want to come clean. You know, obviously the most important thing I looked in addiction is the behavior ending, right? You know, are they not acting out anymore? That's one of the most important things initially. But then, you know, are they willing to truly go to therapy? Is there a turn towards, okay, yeah, harm was done to me, I had trauma, but then I still chose to do X, Y, and Z. I had lots of choices, and I chose to kind of take the lying path, the manipulative path, the harmful path. And now I'm going to do this instead. You know, Sam Batkin says that narcissists have very extreme impaired senses of reality. They don't have good reality testing. They live in kind of fantasy and unrealistic worlds. They have cognitive deficits. So the way that they process things, you kind of hear their thought process and you're like, what did that just come out of your mouth? Like, does your brain really work that way? They struggle with positive emotions. They struggle with empathy. So I really look to see that will exist initially. I look to see if that starts altering, if we kind of get them back into reality. The words that come out of their mouth make less of a like, what the heck, really? That's how you think of things? That's how you see other people? That's how you view this world? That's really frightening. And then my hope is that eventually it starts turning through like 12-step work, shame work, trauma work, etc. So you might ask, how long do I need to wait to see if, you know, my partner changes? What kind of things ignite real change? I can't give you hardcore numbers, but hopefully you now know exactly what I'm looking for. And yeah, it's just, I'm kind of looking for working on someone who is trying to develop who they are now. They've used these kind of scaffoldings of narcissism, grandiosity, fantasy, numbing out through drug or substance abuse as a way of never developing what the real building is inside of them. And I'm looking for them now to start doing that internal work, right? Instead of a scaffolding on holding up the outside of the building, looking like it's the structure. I want to see the building going on inside. Their trauma interrupted their self-development. I want to see them understand all of that, do some work around it. You know, can they endure the fear, the uncertainty, the shame, and the vulnerability long enough for that development to occur? Because it's extremely uncomfortable, and they've avoided these uncomfortable emotions for years, decades, their entire life. Even figure out who they are, what are their values, you know, who do they want to be, do they have goals, what's their meaning, what's their purpose, how do they want to show up for themselves excuse me, and for others. You know, do they have real actual substance inside of them? So hopefully at this time now, you can understand what a narcissist is, what an addict is, understand why their kind of their words and their definitions have become enmeshed and interchangeable. But know what I'm looking for when I'm seeing either of those people move into a state of recovery. Yes, it is all trauma based and attachment wound based, but there is a way out. And so it's fair for you to be asking and expecting and hoping for empathy, intimacy, honesty, and transparency. Some people can get there, some can't. And then you need to make other plans around that. You know, it's kind of that you don't want to do your own definition of insanity where you kind of do the same thing with the same person and hope for something different to happen, but nothing different is happening. That'll drive you crazy. So do be looking for empathy. Are they capable of intimacy? Are they capable of transparency and honesty? Can they adult? Can they take responsibility? Can they take ownership? Can they sit with my imperfections and ask questions about that? Figure out if they can like this. Can they conduct themselves appropriately and make naturally right choices, right? Not questions where you're just, or choices where you're like, what did you just do? Which I do that with my 5-year-old son all the time, but I'm hoping he will emotionally develop out of that and not pee in the shower or something like that. So I think that's about it. And I look forward to your questions.
And we've got some questions. Great stuff. And I think you really hit the nail on the head too with the true narcissistic personality disorder people don't come to treatment. They don't care, you know? And so Dr. Rob has talked about, he's only had a handful in all of his career that were truly, and it's diagnosed with a real professional that knows how to do this, not Dr. Google, you know? I mean, so, but you're right. You know, when people say, I think he's a narcissist, you know, I was like, well, he's got, you know, every addict I really believe has narcissistic traits. We are so focused on keeping the ability to continue to use and whatever. And you said, you know, stopping the behavior. And I would caveat that with stop that behavior and not just switch to another form of numbing out in another way, you know, that is problematic and keeps people away, you know, continues to keep people away. You talked about hobbies, and I have had so many people that in their email address, you can tell what their recreational passion is, and you start, you know, they're calling about treatment or whatever, and you know, I'll comment on that, and they talk about how they aren't doing that. They have not engaged in something that was really meaningful to them because their world has gotten so small. And I say that because, you know, what you explained, you know, lots of people, in fact, it's in the, you know, preamble for the 12 steps is, you know, many exclaimed, you know, it's too difficult. I can't go on through that, you know, the steps. And you know, I want to, as you indicated, you know, the shame and the lying to myself and everyone else, the pain that causes, you know, if we're willing to take the steps, and it's just one little piece at a time, you know, we are not going to, you know, okay, I stopped the behavior and now I'm magically fixed and I'm empathetic and I'm like, I'm the best person on the planet. You know, it isn't. I was at my 12-step meeting the other day and I had forgotten, like I had kind of a motto. I had lots of little mottos when I was active in my addiction, but one of them I had completely forgotten: mutual use and abuse society. And we like that was my motto. And I knew people were using and abusing me and I was using and abusing them.
Right.
And but that is not how I am with anyone now. I like it was like this moment of shuddering, quite frankly, that I was like, that was where I was at. And it, you know, served me and protected me in active addiction. And it is so disconnected me from people and real and meaningful. Am I vulnerable? Sure. Do people hurt me? Sure. On the other hand, you know, I am there for people and people are there for me. So this is so much. It was so worth doing the work. And you said it, it's work. And, you know, it's worth it. It's worth it to be in real communication and real connection with people. And so for those of you that went, oh my God, I can't do that. Yes, you can. And it's worth the effort, you know, to repair ourselves and then to be able to work on repairing relationships that probably were never as good as they could be. People talk about, oh, I want to go back to the way it was. And I would go, no, you don't. You want something that's more and deeper and better than what you had, because now this addict can show up in a different way, in an honest way. So there is hope. There's hope. I appreciate you digging into what's addiction and what's narcissism. And yes, there's a lot of similarities, but there's hope for addicts. We can learn to do life differently. So first question, Kristin, is, I'm sorry for asking something so personal. Oh, don't apologize. Glad you wrote a question. If you would find out that your husband, so let's say this is a betrayed partner that found out their husband is a sex addict, how do they stay with them without resentment, even if you love him and he's been in recovery for 2 years? I'm struggling, and we've been married for more than 30 years. So a partner is struggling and there's recovery, but there's still a lot of resentment. So what are your thoughts on that?
A lot. I mean, obviously, there's a lot of contingencies and details. Like, your body is feeling resentment for some reason. So I don't know if there's just still like, I can't believe that he did what he did. I can't believe that he lied to me. Maybe sometimes you don't. Sometimes partners, at least initially, need to kind of remember their partner is in recovery, and you might need to hear them recite the story again. Look, I was in a dark place. That wasn't me. Those people meant nothing to me. It was just all about me getting my needs met. I don't even know who they were. I was so empty inside. That's the way I sought out intensity to get me out of myself. And sometimes it's not unreasonable for the betrayed partner to kind of need them to repeat that a couple times, because they hear it from such a, like, how could you do that? Like, we were married and we had a family and we had a life, and how did you just shut it off? Remember, they have cognitive deficits. They have impaired realities. So they could just turn something off in a way that you can't. And sometimes you really need to hear that story several times to understand, I did that at one point, but I don't do that anymore. Now I hate the way that I hurt you. I never want to hurt you that way again. These are the things that I'm doing every day to try to repair what I've done. And then it's remember, moving into you. How can I help you feel safe? How can I help you feel less resentful? What do you need to talk about? What do you need to process? And those can kind of melt away the resentments. I want to validate, 2 years, it's understandable to still have major distrust issues, major trauma, major resentment. I'd encourage you to maybe, if it is safe and stable, for you to start exploring your own trauma recovery through like EMDR type things, somatic experiencing, internal family systems, that can help the feeling of that resentment, and maybe even do some couples work. But I will also say this, some people, once the dust settles and the madness of finding out what their partner's done, and then they get recovery, and then you guys go through this process of couples work, sometimes the betrayed partner, when the dust settles and things calm down, they go, okay, I don't think I want to be with this person anymore. Like, bravo for getting recovery. Thanks for finally taking like the more courageous path instead of like the sneaky double life lying path. But like, I'm too angry, I'm too betrayed, I'm too traumatized, and I don't want to be with you anymore. And that's okay too. Sometimes the viability of the relationship is just not there anymore.
Yeah, and I think, what are his actions showing you? Are you seeing, you say he's in recovery, so I'm hopeful that his behavior has really shifted, because someone just giving lip service to, oh, I stopped the behavior, that's not recovery, that's abstinence. So, but after 2 years of, like, there should be significant growth for him. And of course you're delayed because you had discovery, he's known all along he was doing, these things. And, and then you had this traumatic discovery process. So I'm so glad you're here. I hope you're leaning into, we've got on sexandrelationshiphealing.com, lots of betrayed partner support groups, drop in free groups, the podcast, and Kristin's been on those as well. So there's lots of support tools, for you. Hopefully he's doing, hopefully he really is leaning into his recovery. Of course, the various work groups on sex or seekingintegrity.com, for him and for you. But the resentment, the resentment, what I keyed in on is there's hurt. And of course there's hurt, that this has happened to you. So getting help, professional help to help process that trauma, that hurt, for you can hopefully help ease that. I hear that you still care, when there's a lot of indifference, when I read, yeah, whatever, then I think that the relationship is probably, somebody's got a foot out the door, but I hear that you still really care. So, if you can get the help to heal your hurt, then you have a better frame of mind to decide, like Kristin said, in or out, it's ultimately up to you. So next question. My sex addict husband is all or nothing. He says, if I don't want to have sex, he does not want to have any contact at all. Oh, how immature. I'm sorry. He says, if I don't want to be open and vulnerable with him, he doesn't want to speak at all. He says, if I don't want to trust him, then he doesn't want to share anything until I'm ready to trust him. And we should just be roommates. Is that normal for an addict? Any thoughts would be appreciated. This sounds like a raging active addict. So there's zero recovery in this.
Narcissist, right? Like,
Yeah.
again, I care. He's an addict, he's a sex addict. Is he doing anything in recovery? Because it sounds like it's all about his terms, his needs, his entitlement. Again, like I mentioned in the narcissist list, a contempt for you to have feelings and vulnerability and distrust and issues around that. And that life will drive you insane. You've got to see that he's making steps or moving toward leaning into accepting influence, learning what empathy is, taking those defenses down and realizing how much he's harmed you. And of course you don't want to touch him. And of course you don't trust him because he's the monster in the room, and working on how to repair that. So yeah, this is kind of the exact reason why the concepts of is my addict a narcissist come up. And the answer is that as of right now, that black and white thinking is not moving anybody towards healing. That is not recovery.
No. So what healthy boundary do you need for you? And Dr. Rob says all the time, and he said it again on Monday, why would you want to have sex with somebody you don't trust? And so I invite you to, what healthy boundaries do you need to set so that you aren't in that craziness that he's creating. You're not crazy. It's the craziness of the situation. So how do you set up healthy boundaries for you, for your safety? And if he doesn't want to talk to you, come talk to the other betrayed partners on the betrayed partner drop-in groups. I'm glad you're here talking to us. Okay, at the beginning of my relationship, I experienced a lot of coercion to have sex when I didn't want to and do things that I didn't feel comfortable with. It got so bad that many times I felt sexually abused and used. I had no idea that my husband was a porn addict. Recently, I realized that what I experienced, some people call it rape and others don't. For me, it didn't feel, I didn't feel raped, but I felt denied. But I kind of denied it in my mind so I'd be able to survive or move on with life. I'm so traumatized.
Yeah, you're not the only person I've heard that story. There is a lot of abuse. Like I said, in the video I just posted last month, it's that just being in a relationship with someone who is an addict or is conducting themselves with a double life behind your back is very abusive. You experience it as abuse, and they don't need to come home and punch you in the face for that to be experienced as abuse. And this is exactly one of the ways that we are severely traumatized, that you can feel sexually assaulted by your partner, because again, it's through coercion and shaming and blaming and if you loved me, you would have sex with me right now or do it in this way. And that is trauma. And hopefully you will feel safe enough to find a good therapist who works in betrayal trauma and trauma healing to help you work that out, because your body will record that as trauma. So whether you stay in this relationship or you move on, that stuff needs to get worked out, because your body holds it as rape. Your body feels very unsafe to expose itself in that way.
And I think the continuation is, how can I heal from this if I can't say it out loud? And I want to emphasize that, because I almost hear like I feel ashamed that I let this happen to me. So thoughts on that, Kristin? Because I mean that, it's like, I didn't recognize this. I can't say it out loud. So can you talk about that a bit?
Well, she is saying it out loud, and this is why group work is so important for betrayed partners. I will say sexandrelationshiphealing.com has betrayed partners groups. I have betrayed partners groups on my site, Kristin Snowden, because it's this really counterintuitive idea that someone that I loved and trusted harmed me. So I want to isolate and pull back. Yet the only way you're going to heal these traumas is to do work with other people who've been through similar experiences, and you can lean into, and like you said, just speak it, say it out loud, admit it, and then not have someone make a face and be like, what, you're married to him, he can't rape you, and be like, oh my God, I felt that same way too. It's exactly what happened to me. I clench up anytime someone touches me because of what happened, and people understand because they've been through it. So I know your gut's like, heck no, I'm not joining a group and talking about this. But really, this is a part of like, don't think that all of your body and brain are connected and aligned with one another. Sometimes you have to speak out the trauma part so that the other parts of your brain and body can realize it and you can kind of work it out. And I know that's what what all of our betrayed partners groups try to do, is really educate you on how your body records all of this as trauma and the various steps you can take to work the trauma out, but also while forming connection with other people who've been there and understand it, who hopefully provide you a non-judgmental, vulnerable, safe place for you to share this information. That alone is very powerful.
And I hope he's seeking help for, for his active addiction. So, I mean, that's, he can start to change, but you, regardless of what he does, please, 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 get qualified help for you and support. So, and I often get at Tammy, TAMI at seekingintegrity.com, people looking for qualified help. Email me, tell me what you're looking for and where you're located, and I'll do my best to help you find, someone who can work. And I don't get a kickback, trust me. So, okay. How does this relate to trauma bonding and primary love relationships? Also regarding, I don't know what that's,
I'll
maybe
narcissism.
I
think I know what you're saying.
All right.
Yeah.
Also regarding our behaviors according to our attachment styles, while the basis of attachment styles is thought to be formed in early attachment or early childhood, and mostly set, do you see changes in attachment style responses after things like betrayal trauma, meaning that someone with basically a secure attachment style can seem or become anxious or insecure after discovering things like chronic SA, infidelity, etc.? For me personally, it seems that I'm intensely seeking reassurance and feeling dysregulated around issues of trust and desire for connection due to my partner having lied, addicted to destructive behaviors, etc. So.
Right. So let's talk first about that. Trauma is anything that overwhelms your neurobiology, and it records it deep and fast to change you, to make you adapt to the new situation, to keep you safe. So you bet your ass that even if you were in a secure family and you engaged in secure attachment behaviors, which by the way, I have videos and all those things if you want to learn more about that. Something severely traumatizing, like finding out the person that you married and trusted had led an entirely separate double life and has been lying to you for years, and and you're telling yourself, I didn't catch it and I didn't know, you bet that you would suddenly turn into an anxiously attached person or an avoidant person that doesn't want to connect with other people out of fear. That it overwhelmed your neurobiology and recorded as trauma. So it's going to alter the way that you view the world and the way you try to connect from that moment on. Is it healable and recoverable? Yes, which is again why I encourage group work, not just individual work and trauma work, but group work, because you need to heal through other people's connections. And to go back to the trauma bonding, this is what I think you mean. They talk a lot about in the narcissistic world that like you'll trauma bond with a narcissist, like you'll fall in love with the fact that he or she idealizes you and love bombs you, and then you're kind of like, you feel the like, oh my gosh, I'm finally adored, I'm finally validated, and then suddenly they'll dismiss you, and then instead of you being like, well, screw you, fine, like if you're not tolerant of the fact that I'm imperfect, oh excuse me, and walk away. Instead it kind of ignites your trauma of like, okay, fine, I'll run on the treadmill and I'll be better and I'll do better and I'll have sex with you more and I'll be what you're saying that I need to be in order for you to idealize me again and tell me that I'm enough again and love bomb me enough. And then you get into this trauma bond cycle where you kind of chase out of your like own attachment wounds for him or her, the narcissist or whomever, to finally like validate you again. But fast forward to the end of that story, which is that it's kind of been crazy when you think about when we walk around with this gaping wound in our soul because we're struggling with our own flaws and our own imperfections, that we go to another totally flawed human being and think that they're capable of making us whole. They're just as flawed and they're just struggling in the same way that we all are. But that's what we do. We think another person is going to be enough to make us finally feel like we're enough, that we are wholeheartedly valid and good and perfect and all the things, but that's not really how it works.
Okay, and last question. 11 years married to my SAPA husband. Just found out in October, trickled D-days and retractions. Still don't have the truth. He can't even talk to me without blaming me for our situation. He joins Zoom meetings and thinks that's working on recovery, but he's so angry and hateful towards me and the idea of managing, even though he wants monogamy. Do you see SAs who get help after a year or so and are still able to recover their families? Yes, we have lots of, we've got a treatment center actually right now full of them. So
right,
yeah,
but it has to usually be bad enough for them, right? The number one requirement for all diagnoses is that it has to stop working for the person, right? So even if I'm high anxiety, I'm not really struggling with anxiety unless I walk into a therapist or I say, oh my gosh, this anxiety is impairing my relationships, having me struggle at work. My husband says I'm an asshole because I'm so anxious all the time. I can't sleep. Those are all ways that I know that my anxiety is not working for me anymore. So please remember that for addicts, for narcissists, for anxious people, for depressed people, everything works until it doesn't work anymore. And you have to step back and say, is this still working for him? And that's where it comes. This is not your fault. And I'm sorry that this is happening to you. But you have to step back and really realize how this is impacting you. Are you going home walking on eggshells? Are you getting traumatized? Are you feeling like you're taking on all the responsibility and all the accountability and it's not being reciprocated and the load is not being carried on the other end? You have to step back and examine that because this might still be working for him.
Well, yeah, he gets to still be angry at you and blame you. And I'm going like, yeah, I think languaging of like, I hear you wanting to blame me. That's not, I'm not going to take that on. This is for you. I'm doing my support, work here, but your addiction is, I'm here to support you in recovery. But yeah, the anger, that this is still blame shifting. This is still, pushing everything off on you, and the angry and resentment. I honestly think addicts are in the worst place when they've stopped the behavior. So they have abstinence, but they don't have the tools to do recovery. It's like, I'm not Catholic, but like purgatory, where you're in between, you're in that in between spot. And it's like you oh, okay, I'm not going to do that, but I don't know enough of how to do things differently. So yeah, getting getting the right level of help, to change. I mean, honestly, that's what we do, in our program is really unpack all those things and help them be in a very different place. I think that the garage at the residence is full of trash bags of shame and guilt and anger and all those negative, toxic things. They get to leave it there, and then they can go home and be in a different space. And I hear that from partners regularly. I love when I hear from the addicts that it's life changing. I care more when I hear about it from partners who say he's different. I can see it. It's not magical, but I can see it's awkward, and but I can see he's trying and he's in a different place. That to me is what, why we do the work. So
Right.
there is hope.
And why there's various levels of care too, right? Because sometimes people can just go to 12 steps and get recovery.
Absolutely.
That's not working for him, going to the one meeting a week or whatever. So he needs to it's not working. So he needs to go to therapy, he needs to go to outpatient care, he needs to go to inpatient care. Some people need higher levels of care to get to that level of change. So sorry.
But you setting you setting healthy boundaries of like, if you want to be angry and resentful, you can go call your sponsor. And, I'm going to go take a walk. I'm like, what do you need to do to set healthy, safe boundaries for you so that Kristin said it, the body keeps score. Bessel van der Kolk wrote a whole book about, how, and betrayed partners are often dealing with medical issues because of the chronic, stress. So what do you need to do to set healthy boundaries for you so that you are holding up that wall? So, nope, that's you, not me. I'm taking care of me so that hopefully you get some relief, for the chronic anger. So thank you all. Thank you, Kristin. It's great to see you. Thank you. We'll see you again in May. Kristin is always open to topics and things. So email me or her, and we'll put it on the list for future webinars. But this was a really helpful one to unpack. What is narcissism and what is addiction and how do they interact? It's really good stuff. So thanks, everybody. Bye.
Yeah, thank you so much for joining us. Thank you.